What is it about diabetes that makes it so difficult to deal with, and how come good people like you can turn into such head-in-the-sand ostriches in the face of diabetes? The most common way of dealing with diabetes is to avoid it. Some people walk away and pretend it's not there, and others just get sicker and sicker. In fact, it's amazing what people will do in order to avoid diabetes, the health risks and the emotional stress that comes with it. There is a very clever saying that goes like this: denial is not a river in Egypt. Denial is, however, one of the most common problems when it comes to dealing with diabetes. When confronted with the diagnosis of diabetes, too many people smooth it over and bury their head in the sand. Diabetes will just keep getting worse as it goes on for another 1, 2 or 3 weeks, months, or even years in some cases. I want to introduce you to a definition of diabetes, then give you a pathway for intervention and self-management. Before I do, I want to say this. Here's how to scare the life out of a diabetic in denial. Mention these 3 simple words: exercise and healthy eating. You see, there are countless thousands of fat and lazy couch potatoes who'd actually rather die than get up off the couch and live. For some people, the word diabetes means needles, blindness and loss of limbs, and anything less is not being diabetic at all. So this definition starts at a very low level, because diabetes starts out there and builds and grows into a full-scale, life-threatening battle. So here is the definition. Diabetes exists when your blood glucose level is outside the normal range. Now, don't be fooled by the simplicity of this definition. The management of diabetes starts here with 1, 2, 3. 1. Become an expert in managing your diabetes. 2. Do your daily exercise. 3. Eat a healthy diet. So here's the problem. When you don't do this, there will be a slow downward decline in your health and well-being until you have a stroke, lose a limb, have a heart attack, go blind and ultimately die. People bypass the 1, 2, 3 because they're afraid and in denial. You must talk to the professionals who can help you. Diabetes is a sneaky, silent disease, and here are the red flags. Are you overweight? Do little or no exercise? Have a family history of diabetes? Have high blood pressure? Do you have heart disease? If you can see yourself in any of the above, then you have nothing to lose by visiting your doctor and getting started on the road to being educated about diabetes. My name is Mel Taylor and I'm a qualified diabetes educator. So if you need help, then call me on 0402 113 170. I can offer you a free confidential telephone consultation to help you work out what to do next. Call me now before it gets any worse.